All right, folks, welcome. My name is Amanda Demmer. I'm the program coordinator for Community-Based Research Canada, and I'm the moderator for today's e-learning series. Today in our Moving the Dial series, we have with us Dr. Sarah Marie Wiebe and Kirsten Ma sharing a project that is moving the dial on equity-informed approaches to the climate emergency. We have my colleagues, Julia and Sarah, here with us today, who are going to be supporting. If there's any questions that you have, technical difficulties, anything like that, feel free to reach out to them in the chat. This presentation is brought to you by Community-Based Research Canada. Our secretariat is located out of Wilfrid Laurier University, situated on the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples. For those of you who aren't familiar with us, we are a membership-based organization whose mission is to advance community-based research excellence in Canada by strengthening partnerships, building capacity, mobilizing knowledge, and championing community-based research among individuals, communities, and institutions. We are an entrepreneurial social enterprise funded entirely by our member base of over 50 institutional members. As part of our programs, we host events like these webinar and live discussions, as well as bi-monthly community of practice events. You can find information on our upcoming events, as well as recordings of our past webinars and summaries of previous discussions on our website. The link to our website will be shared for you in the chat. In the spirit of reconciliation, Community-Based Research Canada opens each of our e-learning events with a reflection to amplify the goals of the Truth and Reconciliation Commission's call to action. This month, we're talking about equity in terms of climate change, climate emergency. We're highlighting call to action number 22. We call upon those who can effect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. Community-Based Research Canada is committed to continual reflection on the interconnections between truth and reconciliation and the various topics we approach using community-based research. The agenda for today is simple. We will have our webinar presentation by Sarah and Kirsten, followed by a question and answer period. And then we will get into our live discussion, the very exciting part of these events where we get to hear from you, we get to learn from each other, we get to discuss some very interesting and critical questions that have been posed to us from Sarah and Kirsten. The presentation and the question and answer period is recorded and will be posted on our website. However, the breakout groups, the live discussion, that will not be recorded. That's just a chance for us to turn our cameras on, to turn our microphones on, to get to know each other and to discuss. We will be taking notes on that discussion, and the notes will be used to help us create a summary, a graphical summary of the conversation that will be posted on our website. Final housekeeping items before we begin. During the webinar portion, please keep yourself muted. We'll have our focus on our presenters. If you have questions that come up during the presentation, please feel free to put them in the chat throughout the presentation. When we get to the question and answer period, I'll be reading these out to our presenters. So enter your questions anytime and we'll get to them first when we get to our question and answers. So without further ado, I'm honored to be introducing today's speakers. We have Dr. Sarah Marie Wiebe, Assistant Professor in the School of Public Administration at the University of Victoria. And we have Kirsten Ma, Healthy Communities Planner within the Health and Capital Planning Strategies Department of the Capital Regional District in BC. So I'm going to stop my screen share now and pass it over to them to begin their presentation.
Okay, great. I'll just get my slides up here for everybody. Awesome. So can everybody see this okay? Yeah? Oh, doesn't look, actually. I'm just going to try that again. Sometimes it takes a minute to get the slides viewable. Here we go. Okay, great. So Kirsten and I are going to share with you today a bit about our research on extreme heat exposure in the Capital Regional District. And as you've seen by the title, we're focused on moving the dial on equity-informed approaches to the climate emergency. And of course, that's a big problem, but we're really narrowing down to the focused issue of extreme heat exposure with the regional focus of the Capital Regional District. So we'd like to acknowledge a couple of places. So first, we want to acknowledge with respect where the University of Victoria stands and respect the Lekwungen speaking peoples on whose traditional territory the University of Victoria resides, as well as the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with this land and water continue to this day. And also because the focus of our research is within the region of the Capital Regional District, we also would like to acknowledge that we conduct our business within the traditional territories of many First Nations. I believe approximately 20 First Nations have traditional territories in relation to the Capital Regional District boundaries. So this region includes, but is not limited to Pakwachin, Malahat, Patchdet, Penelakut, Beecher Bay, Songhees, Sayout, Sauk, Sartlip, Thacum, and Esquimalt nations. And each of these nations have longstanding relationships with the land and waters from time immemorial that continue to this day. And so we have endeavored to work with some of the First Nations partners, including working through the First Nations Health Authority. But I think this is an area of improvement and consideration and reflection for us as we move forward and do this work and think really intentionally about how we can include and involve Indigenous communities and leaders in a meaningful way. And so this is something that we're trying to do kind of throughout our research, but continuously want to improve upon and reflect on moving forward. I'd also like to acknowledge our team. We have this fabulous team of researchers. When Chris and I started working together about a year ago, we applied for some funding and were successful. And so are grateful for SSHRC, the Social Sciences and Humanities Research Council of Canada, as well as the Michael Smith Health BC Foundation. So we have a couple of partnership engage grant and a collaborate and convene grant. And so with that, we're able to build up this wonderful team. So in addition to myself and Kirsten, we have Alphonsine, who's really been leading a lot of the survey development for our mixed methods approach, as well as Riley, who offered support with some of the background analysis, literature review, and some early inspiration for community mapping. Jumai, who's taking a lead with our sharing circle format, which we'll talk about momentarily, and also Lexi, who's done a fabulous job with the literature review and then building the story map, which we'll share a bit more information about with you as we move through the presentation. And I believe Sarah can put that in the chat for those that are interested, and we'll kind of circle back to that in the discussion. So we wanted to just highlight some of the discussion questions that we plan to circle back to at the end of our presentation. So these are questions that we are taking really seriously and would love to hear your insights and feedback on. So, one being, how can the results of equity-informed, community-engaged research impact policy outcomes? And I'm often telling students, the best sort of outputs will have science or statistics and stories and have that combination, that kind of mixed methods approach. And so we're really wanting to know, at the end of our research, when we gathered all of our data, we've analyzed our findings, how can we ensure that they will have meaningful policy influence, impact, and change? And for us, part of that is planning an action session, an action-oriented session with invited policymakers to come and listen and hear the findings. So we're still in the early days of working through what that will look like when we have our results later in early fall. The second question is how can we include, how to include community voices in our research without overwhelming already overstretched organizations? So how can we include community voices in a meaningful way, knowing that individuals have limited time and capacity and multiple pulls? And so how do we do this kind of community engaged, community-based research without taking away from other priorities that folks have with their jobs and responsibilities. So this question of inclusion in a meaningful way with support and intention is really important for us as well. So we look forward to discussing these questions with you at the end of our presentation. So to give you some specifics, earlier I mentioned that the focus of our project is within the Capital Regional District. And so this is broader than the city of Victoria, where both Kirsten and I live here in the capital of BC, but the Capital Regional District itself has a broader scope and is home to 20 First Nations, 13 municipalities, and 3 electoral areas. And one of the challenges that we found so far is that we have focused a lot on the kind of urban setting. And so two or three of the areas that I hope that we can consider as we're still in the data collection phase is reaching those who are on the outskirts of the more urban areas within the Capital Regional District, how to work with First Nations, and also how to kind of be more inclusive generally across different demographics. So our purpose and objectives, our purpose is to look at service response to extreme heat events in the CRD, but with a specific emphasis on vulnerable populations. And we always want to pause on that word vulnerable, noting that it is a contested term and that it's defined very differently. And so one of the terms that we tend to use instead is priority populations, and we'll speak to that in a moment. And the way in which we seek to engage with these diverse groups is through a mixed methods approach. So for us, that involves a quantitative aspect, which is a survey which is launched and live. And I believe Sarah can share the link with you as well for that, and we'll show you a flyer for the survey in a moment. So we have that quantitative aspect. We have approximately 100 respondents at this stage, and it will be open until the end of June. So that's the first kind of quantitative aspect. And then the more qualitative aspect is, for example, in the survey, there is an opportunity to provide questions and to follow up. And so some folks have written to our group research account and express an interest in sharing their story and their perspective. But we're also convening sharing circles, which is sort of like a focus group where we'll be meeting with different groups and organizations. So the priority populations that we're focusing on for this specific project include seniors, newcomers, and those with the perinatal experience, so pregnant and nursing bodies or parents. And so with each of those groups, we'll be doing approximately 2 sharing circles starting in May through to the end of June. So from these sort of goals and objectives, we're really interested in responses from those who have experienced vulnerability to extreme heat in unique ways. And the goal is to learn from people's lived experiences, from their stories, to improve policy, to take action, to make really concrete, applied, actionable policy recommendations that can be useful to improve service delivery during times of extreme heat. And so we anticipate that the recommendations coming out of this project could be anything from, the location of splash parks or spray parks and parks to changing building codes to communication. So we have kind of a range of recommendations that we're interested in and anticipate hearing. So you're probably wondering, what are your research questions? So we have 4 guiding questions. So broadly, how are local, regional, provincial, Indigenous, and federal governments preparing for extreme weather events in Canada? And again, that's quite a big picture question, which we zoom into with our focus on the Capital Regional District, and ask who are the most vulnerable or priority populations to negative health impacts related to extreme heat events. And so to answer this question, we did start with our literature review and looked at existing reports that have been done. A report that I'd like to mention and acknowledge, which could be shared after, is the Shift Collective report, which focused on lived experience of extreme heat in British Columbia. And they put together a really excellent mixed methods approach, which focused on the entire province of BC. So that report provides some useful information for us as we were setting up our research design. The third question being, what does the experience of extreme heat look like for those groups? And so that's what we're seeking to answer through the mixed methods, quantitative and qualitative approach. And finally, what recommendations do they have for improving emergency planning policy and practice before, during, and after extreme heat events? And each of these questions are important, but we're really hopeful that that last question will offer sort of actionable insights as we move forward and think about, advancing equity in meaningful ways to policy and practice within the CRD. So as I mentioned, when we approached responding to our first questions, we did begin with a literature review, and we were really fortunate to have such an excellent team of research assistants who were able to support us with this work. And I realized as I introduced the team, I didn't acknowledge Erica, who is a new research assistant who's joined us and is also helping us with the literature review and with the public engagement process. So it's really great that we've been able to expand our team as well. So planetary health really is a lens that informs how we engage with this work. And I have to give credit to my colleagues, including Heather Castledon and Astrid Brussel, Bronwyn Dunbar, and others who are doing really pivotal cutting edge research in this field, trying to connect planetary health to policy and practice with the public administration emphasis. And so recently, my colleagues drew my attention to this academic health institution's declaration of planetary health. And so I've pulled a quote here, which highlights really the urgency of this topic. And they signal here, academic health institutions declare the health of the planet a code red emergency and call for immediate implementation of planetary health education and research and the transition to climate resilient and low carbon health systems in order to build a healthy, sustainable, and just future for all. And for me, when I read this statement, which is at the beginning of the declaration, I found it a very powerful, poignant, and direct statement highlighting, this code red emergency, the sense of urgency, this need to do something, this need to act. And what are we acting for? We're really trying to transition over to what would be a more healthy, sustainable, and just future. So this is really a practical exercise and also an imaginative one that involves, really critical and creative thinking about how do we move beyond the status quo and get towards this more ideal future. And so we're hopeful that our research can be a small part of that big picture vision. And so furthermore, I also really appreciate this emphasis on solutions-oriented planetary health initiatives. So our work is transdisciplinary as well. So noting that we come from different backgrounds and disciplines within our research team, we have emerging scholars from public administration, but also from geography, social health and policy, working with Kirsten in planning as well. And so I think when we're addressing these big picture topics like planetary health, we really do need this kind of all hands on deck transdisciplinary focus where we bring different skills, different perspectives, and try to look at this challenge from diverse vantage points. One other aspect that I do want to mention in relation to planetary health is that while we're doing mixed methods research and focusing mostly on kind of human impacts, we do also bring kind of a political ecology lens, meaning that we want to consider human interactions with more than human environments or with natural environments. So for instance, one of the large impacts of the 2021 heat dome in British Columbia was marine or sea life die-off and the impact to coastal communities and coastal ecologies. And so we anticipate that when we're doing some sharing circles and gathering information, people's experience or observation or connection to diverse forms of plants and animals and ecological kind of context will come up in the sharing circles. And so while we're, a survey can only be responded to by humans, we definitely want to consider that human, more than human connection in this work as well. And while the heat exposure project does focus mostly on the human experience, we are hoping to do further research that does expand the scope of our project. So equity, vulnerability, and justice, these are also really important principles that inform our approach. And we think of this as one that is systemic. And I had just mentioned this kind of all hands on deck approach. And here you see in the moving images, multiple hands coming together, putting their hands around this moving globe. And I sincerely believe that we need to bring together different experts. And Kirsten will talk about this in a moment, but to start off our research, we held a public engagement forum with different members, some who had lived experience from vulnerable populations or priority populations, and others who were service providers within the Capital Regional District. And we workshopped our questions together, presented our research questions, and talked about our methodology and strategies moving forward. And in that room, we had quite a range of different people with different backgrounds. And I think it's really important that we bring folks in at early stages of our design all the way through to the dissemination of our results. And we're sincerely trying to do that in an intentional way with our working group that we have in place, and also with the way in which we have involved other kind of community leaders in the planning and design of our approach and for our project. And so if we think kind of big picture when we're looking at equity, vulnerability, and justice, and connect it to the problem of the climate emergency in relation to extreme heat events, for instance, we want to acknowledge that it would be too simplistic to ignore some of the systemic challenges that have led to the inequities or to the vulnerabilities that we're seeing within the Capital Regional District, but also globally. And so oriented towards a more justice-oriented approach then means that we're including those who have been marginalized by policy processes and systems and law and governance, to include them really intentionally in kind of co-designing our project, and then thinking through how we will share the translation of these results as well. So you might be curious, specifically who are we interested in working with and speaking to and learning from. So I mentioned the 3 priority populations that we're focusing on for the sharing circles, which do include newcomers, those with perinatal experience of extreme heat, and also seniors. But in our survey, this is the way that we've identified diverse vulnerable groups. So there's a question in our survey, which is, do you identify with any of the groups? And so these are the groups here, ranging from those with chronic mental or physical health conditions to those living alone, to temporary migrant workers as well. Noting some of these populations are harder to reach than others. And that's something perhaps we could chat about a bit more in the Q&A period. Also highlighting that not everybody has access to a computer or smartphone device to complete a survey. And so we do have some strategies in place for doing paper surveys with some of these groups, but certainly want to think through kind of the multi-method approach that we're bringing to engage these hard to reach or sometimes marginalized priority populations. So I've highlighted a few of the equity and inclusion considerations that we bring to this work. And since our kind of overall objective is to work towards a more diverse and inclusive research ecosystem, certainly from a community engaged research approach. And I also think a lot about 2 concepts of policy justice and design justice, which I think align really well with these equity and inclusion considerations that we have, where those who are directly affected by issues like extreme heat should be the ones informing outcomes and solutions. And we're really trying to bring that kind of collaborative ethic to this work. And so, as you can see here in the second part of this quote that we have on the slide, by building partnerships that take seriously some of the sort of historical and current power dynamics that have been placed in different policy and governance processes, where some communities and voices have been left feeling unheard. We certainly are endeavoring to center those voices and also offer compensation for community members' time for those who share with us during the sharing circle. And are really trying to seek to see our role as kind of in service to community, in service to those who do have experiences and want to share and sincerely want to improve kind of policy outcome and service moving forward. So at this point, I'm going to hand it over to Kirsten, and we're kind of circling back to our questions here, and she's going to go over now in a bit more detail how we've taken these questions and tried to work, with this kind of equity planetary health lens in mind, how to work collaboratively with our community partners in designing this study and recruiting participants.
Thanks, Sarah. Yeah, so like Sarah said, I'm going to speak a little bit more in detail about how we centered equity in our project. And I think, or the main way we have centered equity is by centering community. So these questions came out of community. I work with the Capital Regional District supporting our community health network, and community health networks are unique to island health, although there's some other models around the world that are similar, but we work through the regional districts to bring together service providers, municipalities, because like Sarah said, we have 13 in our region. We have Island Health involved, and then we have UVic and other academic institutions involved in our network, and we work on different determinants of health. And one of our priority areas is healthy and safe environments. And this is broader than just climate change, although it's been very focused on climate change lately because it's an existential crisis. But we were discussing with this group, which is made up largely of municipal planners, but there's also some community organizations, some PhD candidates, and kind of just concerned citizens involved. And we were talking about what our priority work would be for the 2022, but this is an ongoing project. And they talked about wanting to understand who's most vulnerable, not just to extreme heat, but all kinds of different extreme weather events that are coming at us more frequently and more intensely. We decided to start with extreme heat just because it was something everybody was talking about last year, and it was kind of a new thing that we hadn't experienced before 2021 with quite the same intensity. So we as a community group identified these goals because we identified it as a gap in our community. We didn't know, we don't have experience with this kind of event. We didn't necessarily respond the best we could have because we didn't have that experience. And we were hearing from the community that it was unpleasant, unbearable. And we were hearing from the coroner that many people died. We lost over 600 people directly from extreme heat. And then we don't know kind of all of the associated impacts for, like Sarah said, food system die-off, people just not being able to get an ambulance for an unrelated issue because they were called out for so much. So that's why we wanted to look at this experience. Another piece of equity that helped kind of form the research questions was we had the coroner's report on one hand, looking at everybody who died. And then we had a lot of the conversations I had with municipalities was about heat pump incentives. And heat pump incentives are only for people who own their homes, have most of the time standalone homes, and have the means to pay for a heat pump. And so there were this work on both ends of the spectrum, but not looking at everybody in between who lived in an apartment or didn't have a home or suffered, but maybe didn't need to go to the hospital, or maybe did go to the hospital, but wasn't captured. So we wanted to center equity by identifying the questions and coming from the community, but also trying to look at as broad a range of experiences as possible. So that was the first piece, was in our equity journey with this project, is that it actually came out of the community. Next slide, please, Sarah. And then the second step in our equity research design process was, like Sarah mentioned, we created a working group. So this was, we both have some of the municipal planners from our healthy and safe environment subgroup. It was like a subset of who was available and interested. And they provided a lot of feedback on kind of what we should look at in more detail, what they wanted to see, what kind of information would meet their needs. And that was actually really helpful, because some of the pieces that they integrate into planning, we maybe didn't think about, because we wanted to do a lot about the human experience, but we don't know every kind of building and south facing, all of the different aspects. So having their input there was really informative of what could be some of the barriers or some of the more physical challenges or vulnerabilities around extreme heat. So we worked with them in the research design very early on, along with our RAs. And actually, I think our RAs provided a lot of unique input because they're students of all kinds of different backgrounds. And so they have all had different experiences of extreme heat and what that impact was like. And the next step was that we, in January 2023, we brought together, so we created our draft survey, our draft interview questions, and then kind of an overarching design. And we brought together different community organizations that we work with. So people who represent people with disabilities, newcomers, LGBTQ groups, precariously housed people, all kinds of different service providers that are connected to the community health network. We invited them, as well as the municipalities and Island Health, to come to an engagement session to look at our research design and our research questions and provide feedback. And we got a lot of really great things that maybe we hadn't thought about. For example, another group that I left out. We also engaged with our First Nations partners. So we reached out to all the 20 communities. We unfortunately were only able to really build a relationship with Sayout, Esquimalt, and Songhees, which are the more urban nations around us that have, I think, maybe slightly more capacity to engage in some of these things. But when they came and they provided some really interesting input around our survey questions around where you live, they flagged that they have a lot of mobile homes on their properties, which we hadn't thought of, and they often don't have very good airflow or mitigation factors like that. So that was a piece that they gave in our survey questions, but more broadly, the survey questions were reviewed for any triggering language level for accessibility's sake. And then we also connected with CNIBC to get them to review our survey to just give us any tips or tricks to make it more accessible. So that was one question area that we discussed at the engagement session. And then we also talked about our survey and interview, or our interview and focus group or sharing circle questions. And that was a broader discussion as well about what kind of format would resonate best with people's clients. Is it like considering things like language barriers for newcomers or trauma, experiences of trauma, and trying to understand what that experience might be for their clients, as well as the people who attended with lived and living experience. And then the final section that we talked about there was around kind of broad consideration, equity considerations for our research. And we learned a lot of things. One of the things that we hadn't necessarily budgeted for, but was good to flag, was around the compensation. And so one of our partners here, the Coalition to End Homelessness the Alliance, sorry, they just changed their name, the Alliance to End Homelessness in the Capital Region, they flagged that when they do research, they always pay a living wage, which in Victoria is $25 an hour. So we now are offering $25 an hour for people's time. They flagged things like bus tickets or taxi vouchers need to be provided. Food is a good incentive, and really emphasize that aspect that people with lived and living experience are the experts, and that they aren't just someone we're taking information from and moving on, and that will help them by changing policy, but we need to actually help them in tangible ways that they can access right then. So those are some of the things that we learned. We also, other pieces of equity are things like knowledge sharing. So when we presented at our engagement session, we shared the literature review that we did so that the participants there could learn from what we were learning. And then that's also something we're going to do. Sarah talked about some of our sharing circles. So we have some set up with seniors, and we're going to seniors lunches where they already meet to talk about an interesting topic. And so we're going to provide them with some of that information when we come, like who's most vulnerable. But another thing that was suggested was also bringing some of the resources that have been made about like how to cool your home down, so that we're actually giving them strategies, not just saying, oh, how hard was that? Okay, bye. But we're actually like, okay, maybe next time, like here are some things that we can share with you, some resources that we know of. What else? I'm just checking my notes to see what else is we learned. And this is maybe something I'll chat more about in the recruitment slide. So you can change them now, Sarah, because I'm kind of overlapping. But some of the other pieces that we need to keep in mind when we're trying to collect stories and information as equitably as possible is that it's a privilege to be able to access these people and their stories and organizations, and it's not like our right, and we're not coming in as this great thing for organizations. Many times it's actually quite annoying for some organizations to have researchers come in. So some of the ways that we work on that, and that's part of our recruitment, is, like I said, with our seniors, we're coming in at an existing time where they're already gathering, and we're just using the people who already come and not necessarily bringing in additional seniors or advertising it, because we don't want to disturb their group. We're also working with the Intercultural Association to use some of their existing groups around their language classes, and just really trying to make it as easy as possible and not shift their experience and their calendars too much. One of the pieces that kind of illustrates this is that we wanted to go to some of the young parent groups to capture that perinatal experience, but they don't really sit around and do like a workshop each time. They do more of a kind of free flow, play with your kid and chat with other parents. And so instead of going and doing it at their normal gathering, we're going to provide information about an outside session that we'll be doing. So yeah, being very flexible and responsive to the needs, and when it does make sense, kind of taking advantage of those pre-existing circles. But if it does not make sense, then trying to accommodate in other ways. So taking a step back around recruitment, this was another place where community was at the center and where relationship is really key. So I, in my role, have a lot of connections to different community groups and service providers. And so one of the main places we started with when we were looking to kind of organize our sharing circles and share our survey, I went to the Coalition of Neighborhood Houses, which is all of the different community associations in our region. They come together. And so the community associations provide services from prenatal groups all the way to seniors lunches and everything in between. So they touch definitely perinatal experience and seniors, not as much with newcomers. But I went and I gave them the flyer. I talked about what we were planning on hoping to do, and we can collectively brainstorm some ways and some events that we could leverage that they already host to access people's stories. So that was one piece. And then I have an existing relationship because one of our other groups is newcomers. So we were able to connect with them and share that information. And they were able to help us start arranging those sharing circles there. So those were some really key relationships that I pulled on for sharing circles and a bit for the survey. And then more broadly for the survey, we did some brainstorming with the Healthy and Safe Environment subgroup, and then also my broader community health network to discuss how we could share this flyer, who could share the flyer. And we've had a lot of the municipalities share it out via social media and on their websites and newsletters. And then we've had other community organizations send it out in their newsletters and post it physically in their spaces. And then a final kind of win for the survey flyer. The Capital Regional District has different housing. So it ranges from subsidized to affordable to market. And they have, I just printed off 54 flyers for them, and they're going to be putting them up in all of their buildings. So I think the key message from all of this, there's a few, but the main one is that centering community really helps center equity in our research, and making it meaningful for community to engage and engage early on is really important, because they are bought in. Everyone we talk to, because they have a relationship with the community health network and a lot of the people involved, and because they understand the work that we're doing and that this topic came from community as a very important topic, everyone we talk to is very engaged and very supportive. So those are some of the keys. And then the other key that I would just note is circling back to that piece that doing research with organizations is a privilege, because they are overwhelmed with need. The need in our communities is higher than ever coming out of the pandemic, and being able to access and work with them even for an hour to chat about how to coordinate is a great privilege. So we need to treat it like that, and we need to respect their time. So this is our last slide, and maybe I'll just touch a bit on how it kind of continues our equity journey and then hand it over to you, Sarah. Does that work? Yeah, so the last piece, I guess, too, is our future vision. So we are hoping in the fall to bring together that local governments and their climate action planners, emergency response people, as well as potentially some provincial people. And then there might be some federal, but also our health authorities. So we have Island Health and then the First Nations Health Authority, who provide services in our region. So we are hosting in the fall this session, and I keep calling it an action planning session, but I also have to acknowledge that I have no power to force anyone to commit to anything, but I'm hoping that some of the municipalities will hear what the recommendations are coming out of our research, and that they will be able to then identify some solutions that they can implement based on this approach, and then move forward with actually doing it. And I think one of the pieces is that we have the ongoing healthy and safe environment subgroup. So this isn't going to just kind of be a report that ends. I chair that, so I will continue to bring this up and bring out our recommendations and check on what's going on with them. And another piece too about kind of our report back is that we want to make this information accessible to the communities that we received it from. So wanting to report back to the Intercultural Association, the community associations, and telling them, this is what we heard, this is what we're going to do about it. So that's another key piece. Sarah?
Yeah, thanks, Kirsten. And what I would add to that is that we're also trying to think kind of creatively about how we do the knowledge translation and dissemination piece, starting in September when we have some of these findings and recommendations. And we were brainstorming yesterday about doing a podcast or just trying to use different forms of media to do that work. And you know, we could do things like little videos or stories, snapshots of what we heard. So that's a possibility, making a little video, or elaborating and enhancing the story map. And I think the link to the story map was in the chat there. So perhaps enhancing something like a story map with information about the project, information on the topic, and then embedded links to potentially videos or podcasts. So that would be a great point of conversation as well. If anybody who's participating in the webinar today has insights into different ways of communicating your results for various audiences, including that policy audience, but also including those that maybe haven't been engaged in this research so far. I think that would be a really fruitful discussion and conversation to have. So I think that does bring us to kind of our last slide. And here we have our contact information. So if you want to write to us later and be in touch, here is our information. These will also be posted with the slides that Amanda will post later. I'm on Twitter, and I tend to post a lot of information, you know, related to this topic, or retweet news articles. We were fortunate to have a little bit of media engagement so far with this project to help us spread the word. And so CBC and Check News, and then some of the local radio stations here picked up on that. And it's, I think, really important and meaningful to be part of a bigger conversation about how do we kind of collectively respond to climate change. So if you're interested in continuing the discussion, you know, follow on Twitter, and please reach out to us. We also want to say thank you, of course, to our funders again. As mentioned, we have received support from the Social Sciences and Humanities Research Council of Canada, as well as Michael Smith Health Research BC, and both have been really, you know, great in terms of supporting this kind of community engaged research. And so here we are now arriving at our discussion questions. So First being, how can the results of equity-informed community-engaged research impact policy outcomes? And then how do we include, this should be a we here, how do we include community voices in our research without overwhelming already overstretched organizations? And then I think, you know, on the fly here, I'd add a third question to this, which is like, how can we communicate our results in diverse mixed media formats to reach our priority populations and policymakers? So with that, I think I'll conclude the formal part of our presentation and stop sharing my screen and say thanks for your attention and your time, and we look forward to the discussion.
Thank you so much, Sarah and Kirsten. It was so fascinating to hear. You know, equity-informed research is becoming a kind of a trend, a hot topic. Lots of folks are wondering, how do we bring that equity lens to the research that we're doing? And you've shared here a really tangible example of taking an equity lens to an issue that we all face in society, the climate crisis, and specifically extreme heat events. So thank you so much. We have about 15 minutes now for question and answer. So anyone who has questions that you would like to ask Sarah or Kirsten about this research project, please feel free. Please type your questions in the chat box and I will read them out loud. And thank you. I see, Sarah, you saw Patsy there asking about the contact information. You put that in. Thank you. So yeah, please enter your questions in the chat box. And I guess I have one to start us off, just as we're thinking about, you know, this movement towards equity-informed research and how do we do this well. So I'm wondering, for yourself and your research team, what were some of the things that you did to prepare yourself to taking this equity-informed approach to your research? Was there specific trainings or discussions or kind of just even informal talks you had with your research assistants? What internally did you do to help yourself taking that equity-informed approach to your research?
Yeah, it's a great question. And I think everyone within our team had a different kind of background, comfort level, and knowledge of equity-informed research. And so we do meet weekly as a team, which I think is really great to kind of check in and start our meetings with a roundtable. How are you doing? What's coming up for you this week in relation to not just the weather, but also kind of this research? I am a big proponent of students using their kind of RA hours, the research assistance hours, for some professional development. And so whenever there are relevant workshops on campus or webinars, I send the information, say, you know, take this as part of your hours. One of my colleagues is the leading expert in knowledge democracy, and so was offering a workshop on campus, and that's Bud Hall, and whose work is also really kind of influential in our approach. And I suggested, you know, come to this workshop, and I think that really helps connect some of the big picture challenges with strategies for addressing these challenges, because, you know, climate anxiety is a real thing, that there's a heaviness. So how can we kind of build community within our team and within not just our small team, but, you know, big picture? And I think connecting to organizations like Community-Based Research Canada and others helps students and researchers in general not feel as isolated. And so I think trying to find any ways to build connections, build community throughout the project itself is really important. And yeah, it's a good question. I haven't actually thought about it in those terms before, but I think it's so true to try really hard to create a safe, engaging, meaningful atmosphere amongst your team. And as academics, we don't get a lot of training in like management, like managing teams and people, but I sort of wish we did. I think I would benefit, and I know others would too, of thinking really intentionally about the question that you just asked. So thank you for that.
I think because we meet weekly, there's just some like things that come up, and it just is addressed like in our conversations, in addition to the stuff Sarah added. Like, for example, when we were creating the survey, the students kept calling it like pregnant woman, referring a lot to pregnant women. And so we had a conversation about how pregnant people can be pregnant and not just women. So just little things like that as well, just flagging them and having conversations about what that means, and then having them attend. So when we had the conversation with CNIBC, Yeah. One of the students attended, and so they got to learn from that. And then they all attended the engagement in January and got to learn from people in the community and talking about what the considerations are there from their point of view.
Mm-hmm. Mm-hmm. That's neat to hear. So, in developing the expertise or capacity of the students, then they can start to think critically and bring critical questions or thoughts to you. And then it sounds like you encourage just that space for dialogue, changing the wording of pregnant people and just encouraging that critical thinking about it. Sounds like it was supportive of the students developing their skills, but also that supportive environment for folks to bring anything they've learned outside to the research team as well. Very neat. So we have 2 questions that just came in the chat. So the first question is, have you reached out to warmer countries who are already suffering from extreme heat to ask what they are doing?
So the scope of our research is our region, because I am I'm embedded within the Capital Regional District, which regional districts are a BC unique thing that common places. So that's what our scope is, but it is interesting in conversations with like the Intercultural Association and other organizations. We've been talking about how people expect them to be better at responding to heat here, or they themselves, newcomers from warm countries, expected themselves to be able to deal with the heat dome. But it's totally different here, because their houses are made to let the heat out. Our houses are made to keep the heat in. Our culture is different. Like, we don't get the like we don't work, maybe they might work early and later, and we work during the hottest time, and we haven't accommodated for that yet because it's not been a thing we've experienced. So we haven't reached out to anyone. It's been a bit in our research we've touched on. We're writing a chapter where we talked about COP27 was happening while we were writing it, and there's a lot of that like binary, or not binary, kind of tension between global north and global south, and how like that conversation has been part of our research, but we haven't reached out to anyone, and it's outside of our scope to do so, just because we're really focusing in on our local stories and experiences.
I'll add to that to say that while we haven't at this point reached out to other jurisdictions beyond the CRD, we definitely have had interest from different levels of government. So policy officials at like the Climate Action Secretariat of BC reaching out saying, oh, we want to learn about your research and what you're doing. So I think that kind of in September, once we have the results, that might be a really insightful time for meaningful kind of outreach beyond this jurisdiction. And I've been thinking a lot about India, actually, and I don't have any personal connections or relationships to India, but certainly they've been really affected by heat waves. And I think it was 9 people passed away recently due to heat stroke. So I've been trying to get up to speed a little bit on different policy recommendations and outcomes. And so one of the, facets of an academic position is going to conferences and chatting with people and learning from other places. And so I could see it being really beneficial at some point to have opportunities for further engagement with what's happening in other places and learning about how people are responding and what the recommendations are, and then maybe taking some of those practices and thinking about how they would apply here. So far we've been really locally focused, but given that this is a global problem, I think there are really natural and emergent connections that we can build upon and hopefully do that sort of intercultural learning.
Yeah, there's always something to be said from, learning from other places, learning what's worked and wasn't worked. But when we're doing community-based research too, it's really that push to understand the local context. So it sounds like that starting place of understanding what's going on locally and knowing what folks are experiencing at the local level and the context and the constraints and the current political environment. And, Kristen, you were talking about the work environment, the housing structures. Understanding that is really in the spirit of community-based research, that community-driven approach to it, as kind of a starting point. And we always talk about the community-based research cycle, that you kind of finish one project and move to the next project, and sounds like as this project you're working on continues to grow and expand, bringing in those perspectives or those best practices, starting out with that local grounding was a great way to start this project. So another question, can you give examples of which policy changes can help with extreme heat? So I can only think of small scale items such as instant heat blocking curtains at the homes of elderly or pregnant people, funding cooling sleeves that are already available for women suffering from heat shocks, patients undergoing chemotherapy. So what examples would you give of potential policy changes for extreme heat?
One thing that is already happening that is fine, but also a barrier to a lot of people is heat pumps. Incentives are a huge thing that is being relied on. But like I said, like I live in an apartment, I can't put a heat pump in. And that's the experience we're trying to capture. Some of the other things that we have discussed and I've had discussions about is around building codes, because we have minimum heating requirements. We could have cooling requirements as well. And one thing, even though it would be a lot to ask buildings to retrograde every unit, there is potential that we could have conversations about having a cooling room. That could be the hallway, that could be a common community room. So integrating that into building codes, but also like requirements for landlords or building owners. I'm trying to, I had another one, but some of the recommendations that came out of the coroner's report, well, they actually didn't end up coming out, but were things around like giving people with disabilities, seniors, everybody an air conditioner. That's a lot of money, but it would be a potential solution, although then it's contributing to climate change. So there's this cyclical effect. And some of the pieces too that we're hoping to impact is around like isolated seniors, vulnerable people, and it's more in like policies of home care. So we had a conversation the other day with Island Health's home care team to talk about like what they do in those situations, and they're using an existing like vulnerability kind of scale assessment tool, so that when these events happen, they'll already know who's most vulnerable, who they need to check in on. So changes like that, I would like to see a cooling room requirement and some responsibility being put on landlords, because they are also a barrier sometimes to, like, rental agreements don't allow air conditioners sometimes. So that's another piece too, is making it so rental agreements can't bar you from having these life-saving pieces. Oh,
right. Yeah. Or rental agreements I've seen that will charge you extra if you're going to have an air conditioning unit running, or things like that create barriers.
Yeah, some that I've been thinking about are maybe really small ones, like new parks, or most parks should have some sort of like splash park or water access. I couldn't help but note in Victoria, where I live, that sometimes the misting stations that were implemented were, they were done quite swiftly, which is great, and built off of fire hydrants, but sometimes they were in sort of unsafe places, like in the middle of a boulevard. And I thought, who's going to hang out in the middle of a really busy street? And my son's daycare is right there, and I just thought it's not like a safe area that you'd want people accessing. And so I think much more intentional design is required in terms of planning, in terms of development, in terms of where people convene and play and gather. And I came to this topic because of my own lived experience being a nursing parent and being extremely dehydrated. And I'm not usually one that goes back to sort of health promotion, but I think I would have personally benefited from more awareness of just how dehydrated I was going to be and how much water. So maybe having access to better information about like the amount of water you need when you're going through a heat dome and you're nursing, because I ended up in the hospital. So I think that ideally I've been approaching this research hoping that, what happened to me doesn't have to happen to other people, that you're better informed, better aware, better prepared, and that you sort of know what to do besides just like standing in your bathtub with your feet in a cool, puddle of water. I think we can, I guess we want to plan better for this moving forward. So those are some small little things. And I certainly think that like the changes to building codes will be possibly a recommendation. So we'll probably have this kind of scaled approach, some really local examples, and then move up towards different kind of policy jurisdictions.
Excellent. And there was a comment in the chat, this idea of moving away from lots of dark concrete in urban areas that may attract or trap heat. The idea of different materials. So lots of suggestions, and Sarah, with you too, about like infrastructure, like city planning, things like that, intentionally building cities. Where I live here in Waterloo region, I don't know if this is at all heat emergency related, but I noticed for this summer, there's a lot of new umbrella, like the permanent shade structures that have been erected around the city, and water features that have been erected, and things like that. So I don't know if it's intentionally because of planning for heat, but certainly it seems like some of the planning that's happened will benefit the heat issue. We're at 1 o'clock, so this is when we normally will transition into our live discussion. So I know there's one more question in the chat, and perhaps we can get to that in our live discussion. So just for the sake of everyone who has to take their leave now before we enter the live discussion, or anyone who's maybe watching this recording after the fact, I will do a bit of a formal wrap up before we move forward into our live discussion portion. So those of you who do have to run, you may want to know how you can keep in touch with us here at CBRCanada, how you can learn about future events. Our website will have all of that information for you, and Sarah will share the link in the chat where you can sign up for our newsletter if you'd like to be alerted of any upcoming events. And a very large thank you again to our presenters, to those who asked questions in the chat, to everyone who engaged with us. Everyone came out to watch the presentation today, and to anyone watching this recording at a later date and engaging with us that way as well. So we now will be stopping the recording and moving into our live discussion portion. So thank you, everyone.